Yes, every the egg freezing process, every case is individual. How someone responds to the medications depends upon their age as well as their ovarian reserve testing. The medications that are used are medications that's typically called FSH, and FSH is a hormone that's made naturally from the brain and stimulates the ovary to make an egg. But in a woman's natural cycle, she's only going to select one egg. So what we do to have multiple eggs being formed by the ovaries is to use this hormonal medication, which consists of FSH, to stimulate the ovaries to make multiple eggs, so she can make multiple chances of having eggs frozen in the future. The medications are there's the biggest side effect of the medications. I always tell people are a couple. Here in the U.S., the medications are expensive. In Europe, the medications aren't so expensive. The other thing is that they are injections that you have to take every day for about 10 to 12 days. And then finally, the biggest medical concern is if a woman makes too many eggs, then you have to worry about a syndrome called ovarian hyperstimulation syndrome, which can lead to bloating and the feeling of being uncomfortable for about a week after the eggs are retrieved. And in very rare cases, a woman could end up in the hospital with severe dehydration. So we try to avoid making too many eggs, but the right number of eggs is individual and is based upon a woman's age. Ovarian hyperstimulation syndrome does not happen quite often. It's less than 5% of cases. And the key is to recognize people who are at risk for ovarian hyperstimulation. These are, well, for example, if someone has polycystic ovarian syndrome, they're at high risk for developing ovarian hyperstimulation syndrome. So you want to tailor your stimulation protocol to a lower amount of medication so that she doesn't make too many eggs. So that's the very rare to occur, particularly nowadays when we give the final instructions to the eggs. There's something called a trigger shot, and previously that trigger shot was HCG, and HCG lasts in the body for about 7 days. So women who were at risk for ovarian hyperstimulation, their ovaries are still stimulated for 7 days even after the eggs were retrieved. Now we use a medication called a GnRH agonist. And what that does, it mimics the natural LH surge that a woman has when she's about to ovulate. So we give this trigger GnRH agonist, your LH levels go up, gives the final instructions for maturation to the eggs, and then the next day the levels are back to normal. So that risk of ovarian hyperstimulation is minimal to none using the GnRH agonist.